And we'll share my screen. If everybody could just make sure you're on mute, that would be great. All right. All right. So to get started, same as every week, this meeting is for school and health department personnel. If you are anyone else, we'd ask you drop off the call just so we can save time for everybody else. But this will be posted on our websites within the next few days for your viewing. Whatever information we share today, just make sure you pass it on down the line to whoever frontline staff you have that might need it. First thing I wanted to share, I just found this week. The policy lab is through CHOP, the Children's Hospital of Philadelphia, and they've come out with some good guidance and different blog posts and things over the last year and a half. They put out their updated guidance for fall. The link is on here. They give a lot of good guidance for mask optional schools. And for those of you out there that are in that situation, I'd really encourage you to read it. It's not very long, but I just share one table here from that where it just gives some ideas of times where you might consider adding in masks or times during the day where you might encourage masking more. So, and things to consider, if incidents in the community gets a lot higher, you're seeing a lot of cases in your school, a lot more cases in kids in the community, your school has a really low vaccination rate, and younger kids who might not be able to get vaccinated, you have a lot of people with health conditions in the community, or a lot of kids in your school that have health conditions. Those are times where you might think more strongly about masking. And then, times when kids are more clumped up together, transitioning in the hallway, waiting for lunches, things like that. Those are times where you may encourage masking more in your school. This is just one little piece of that whole report. Again, the whole thing is really good to read through and it is not very long. So I just wanted to share that. On that idea of vaccination rates, this is the fully vaccinated rates for all those 16 and older in our counties. Michigan as a whole is over 50% vaccinated. You can see most of our areas are not over 50% vaccinated. Some of our counties are a little bit on the higher end of that, but still, not vaccinated enough to really keep things under control. But just so you have an idea where you stand in your communities. This was from one of the Policy Lab's blogs, and they just did a scatter graph here showing how the adult vaccination rate seems to be correlated with pediatric hospitalizations. Michigan here is right in the middle. They had us at about 60% fully vaccinated for adults, so over 18, whereas that image before were for people over 16. And our hospitalization rate in kids is pretty low. We are in the later part to the party here with this new surge, but looking here in the southern states that have had really low vaccination rates, they've had really high pediatric hospitalizations. Not definitely proving cause and effect, but just showing this association. It seems like every week I have to retract something that we've said last week. Based on what our reps from MDHHS were telling us and asking us to remind people of, I reminded you not to use MICR to look up student or staff vaccination records. Well, luckily one of our school colleagues shared with us an email that you all should have gotten last Friday. We did not get that email in the public health world, but apparently that email provided 3 different links, and these are live links here. So if you don't know what I'm talking about, when you get this slide deck from us, you'll be able to access those. But in a nutshell, MDHHS, again, other side of the mouth, confirmed in their opinion that you can use MICR to look up students' COVID vaccination status. And if you have written consent from your staff, you can also look up their vaccination record. So I apologize again for confusion. We'd hope communication would get better by this time, but it still struggles. And we appreciate you guys updating us when you get new information, because again, it doesn't always flow everywhere. Just a clarification, clarify some of the things that we've gotten questions on over the last week. You know, again, a reminder that if people are fully vaccinated, they do not need to quarantine. They are still considered a close contact. And so the fact that they are still considered a close contact and they do need to be told that they were exposed, and the newer recommendation that they should be encouraged to wear a mask and be tested, has caused some confusion. It's like, well, if we have to do all that, then how come they don't have to quarantine? So, so just a reminder that they don't have to quarantine, but these newer recommendations from the CDC are there because even though it's really, really rare, they can get infected, and the new Delta variant has been proven to cause a slightly higher risk for infection in those who are vaccinated, and is proven that even though a lot of these individuals don't have any symptoms or may just have really mild symptoms, they can still spread the infection. So that's why the CDC added in, you know, you want to make sure and tell them, have them wear a mask, have them get tested just to make sure they're not infected just because of that. I know it adds in confusion, but again, they don't have to quarantine because the risk is so low, but just to be safe, those other recommendations are there. So to avoid inadvertently quarantining people by accident, before you start calling kids or you know, doing any, I said before doing contact tracing, but once you've done your contact tracing and before you start telling parents to come pick up kids or that kind of thing, check the vaccination status on anyone who's 12 or older, or at least when you do call them, just ask, you know, that's a lot of work, I know, just ask them if they have been vaccinated, just to make sure you don't inadvertently make somebody quarantine who, you know, got vaccinated and did what they can to not have to be quarantined. Now, modified quarantine options, there has been more and more evidence to support this, and those are options where we could, with particular safety measures in place, could potentially allow kids who have been close contacts to continue coming to school. The goal, again, with all of this is to keep kids in school. So MDHHS has been working on a plan, and they have discussed it with Michigan Department of Education and some others. It's supposed to come out publicly next Tuesday. Likely it will include some kind of a test to stay option. So if people are testing negative, they can continue coming to school rather than quarantine. Likely it will require that both individuals were masked at the time of exposure. We will share it when we get it, assuming you are also going to get it, but we just want to make sure that everybody does get it. We will look at that, and if we feel that we can provide some more flexibility or some additional options, we will share that too. So just to know that hopefully we can give some additional approved options next week. We decided that since the data is changing so much, and I think most of you are very familiar with the data websites, that we're not going to put together the data tables anymore. If that is a problem, you can let us know. But honestly, by the time we get that data to you, we pull it on Tuesday or Wednesday. By the time we get it to you on Thursday, it's already wrong. So just as a refresher, I'm going to pull up the mystartmap.info. It initially will show you the CDC transmission indicators for the state, and you can drop down on these arrows and it will show you the curve. So the state as a whole has 9.1% positivity, and you can drop down on the cases.
Hey, Dr. Morse, we're not seeing your screen. Oh, never mind, it just updated.
Yeah, sometimes it's really slow, but I'm glad it did that because I don't know what I would have been doing wrong. And then again, just a reminder, you can go back 6 months or show the whole trend to see where we're at. I think default is 3 months. So this is the cases per week. And then if you want to see the Grand Rapids region, you can just click on that. And if you want to see your county, we'll pick on Mason County today, you can do that. You can also use these drop downs to select those different things. Now, if you want to see the Michigan way of doing things, you hit this click down and you hit My Start Map Levels, and it makes you confirm it, but you just click on this blue box. Note that I still have Mason County selected, so I'm just going to go back and pick Michigan. And again, just to start it off, you can close them all down, but if I want to see test results, and with this one, the other one too, but you can hover over and get a bit more data here. And then they tell you how many tests are being done, and then you can get new cases. So again, you can really find out quite a bit here. You can also compare if you want. This is a newer feature from last year. So you can pick which different indices you want. Not every county has all of them available though. And I usually add in antigen tests because a lot of our cases are being tested with antigen tests. And then you can go through and click what counties you want. So if you cover a few counties, it only shows where they're at right now. You don't see that nice trend. So again, we will allow you to just find your own data using this. That way you can see your trends and have more up-to-date data. But if that's not sufficient for you, I guess you can add an antigen test there too. If that doesn't work for you and you want those weekly tables, still let us know. But again, it's typically out of date by the time you get it. So this is the website here for you in case you need it as a reference. This is the slides I'm going to share again are from the weekly data and modeling update the state puts out. One slide they shared, they had put together how many school districts had a mandatory mask policy versus how many didn't, or they didn't know for sure. So they calculated that 40% of school districts did have a mandatory mask policy. You know, most of our schools are in larger urban areas, but I just thought that was interesting, so I thought I would share it with you guys. Now for just an overview of how our state is doing. The whole country now is at high transmission. Our percent positivity has continued to go up, and our case rate has continued to go up. We're still in the lower half of COVID incidents in the country, but we keep catching up. Again, almost all of the genotyping done to see what kind of variant we have. Almost all of it is the Delta variant now, and has been for the last month. So it's safe to assume pretty much everybody getting COVID at this time has the Delta variant. The number of people in the hospital with COVID is increasing. The inpatient bed utilization, I think that was increasing as well when I saw the curve. Our death rate has been increasing. So just all consistent with a surge. So this is our weekly case rate. With the ages, the school age kids, the 10 to 19-year-olds are the 4th highest age group affected right now. But if you went back to last week's slide, you'll see that the percent of increases have really dropped. So things are still increasing, but hopefully, it's too soon to promise, but hopefully maybe things are starting to level a little bit. We had quite a few double-digit percentile increases. Oh no, I apologize, I'm reading this wrong. No, I think, yeah, last week we had some that were like 12 and 15% increases. So we are seeing a slowing of how much these are increasing. The largest increase was in 60 to 69-year-olds. Sorry, I'm confusing everything here. The childhood rates are slowing a bit too. Last week, 22.4% of all cases in the US were in kids, and this week it's the same. So it had been increasing quite a bit each week. So the Delta variant, again, it just continues to be confirmed in more counties. It's likely in every county, just whether or not they've sequenced all the county variants is more the issue, but again, safe to assume it's pretty much everywhere. So our hospitalization rates continue to go up. Maybe we're starting to see a leveling. It's hard to say, but we can cross our fingers. I showed this last week. It's just updated data, but the vaccination rates in the US have overall continued to increase. We're in Michigan. We've just stayed pretty flat for the last couple of months. Updated data for breakthrough cases through the 24th of August have shown that of all the people getting infected, 96% of them have not been fully vaccinated. People in the hospital, 93.5% of them have not been fully vaccinated. And of those who have died, about 95% of them have not been fully vaccinated. So still, the vast majority of people getting sick, hospitalized, or dying have not been fully vaccinated. Then just a little update for any of those of you who might be interested. The ACIP met on the 30th, and one of the things they talked about were booster shots. No decisions were made. They're going to meet again in September, and then the FDA would have to make approvals as well. But it is thought that what will come about will be a recommendation for a booster of mRNA vaccine. So if you got Pfizer or Moderna, they would recommend a third dose 8 months or more after your second dose, likely starting with healthcare providers, people staying in long-term care facilities, and those over 65. So kind of starting with the people who got them first because they're furthest out and they seem to be at the highest risk of getting breakthrough infections right now. So again, that's what the thinking is. So again, they have to discuss it more and would have to get FDA approval for that. So that is different than the third dose that's recommended and already approved for people with severe and moderate immunosuppressive or immunocompromised health problems. So I know that gets really confusing. So that's all I have for my slides today. I will stop sharing my slides. Sorry, I just don't like Teams very much. All right, stop sharing my screen and I'll get to my questions here. Okay. So regarding the possible test to return early information that you mentioned is coming out, both students were wearing a mask. How does wearing a mask and not wearing a mask differ with being tested to return early? What is the difference? So the evidence that was found during the school year last year was that kids that are masked, both the person who's sick and the person who's not sick, the risk of infection to those kids in school is extremely low. And so it's felt to be the risk of having them in school and causing more infections is extremely low. So if I was tested this morning and was negative, I could still be infected and I could still become contagious during the day. So adding in the testing is just one more safety net to make sure that person's not infected. If people weren't masked, the risk for infection were much, much higher. So if I tested negative that morning, the risk of missing an infection would be much, much higher. So basically, if we're going to get rid of one safety net, which would be quarantine, we have to have other safety nets in place. So it's that Swiss cheese model. You can't take away pieces of cheese without having other ones there, or else too many things will fall through the cracks. Again, there is evidence to support potentially some other options. And so we will look at what the state does finally come out with and see if we can't be a little more flexible. So, but again, it's just, you have to look at what's the risk for infection, and then what's the risk then they're going to come into school and spread it more. And that's where we're getting outbreaks. What symptoms are prevalent in the children who have contracted the variant? So for the most part, it's pretty much the same as any other COVID infection. One thing that I have seen that has been published is in those that are vaccinated, sneezing seems to be a more predominant symptom, but really for most it's the same. The issue, as we know with kids, is their symptoms can just be really mild and different than adults. So they might just have a runny nose and a sore throat. They might have more nausea, they might have more diarrhea. So it can be really challenging. Are there any recommendations for international travel as far as quarantine? Those are the same. So if you're vaccinated, the recommendations are you don't have to quarantine. Afterwards, the recommendation, I believe, I honestly have to admit I haven't looked recently, but I'm quite sure they're the same as they have been, where it is recommended you try to stay home as much as possible for 14 days after international travel. Again, honestly, you know, our rates are typically as bad, if not worse, than a lot of other countries. And so requiring quarantine of anyone after international travel, I don't really feel is necessary, but I would need to double check on the website just to make sure it hasn't changed. I haven't checked that recently, but I do not believe it has changed. Again, it's recommended if you're not vaccinated. It's not if you are vaccinated. But trying to make a requirement for it would be difficult. What does the data say regarding the immunity of people who have had COVID? We hear a lot about immunity from vaccinations, but not about those who have had COVID. Yeah, it is challenging. There are reports that it is quite long-lived. They still continue to only give you a 3-month guarantee with re-exposure. I don't know when they're going to change that. There have been some studies, though, that with the vaccine, you have better long-lasted immunity, which is your cellular immunity. It's kind of like your reserve force that's ready to react if it's re-exposed than you would with natural infection. But again, there's other studies that show that for most people, natural infection gives you immunity for months to, you know, now we have a year or two of data for even that long. So I know it's really frustrating with this because the data and the evidence keeps changing. We are very frustrated by that too. But for the most part, people should not be getting infected. We do see it, just like we do see breakthrough infections with vaccination. But unfortunately, they still have that 3-month window on prior illness. Are last year's medical mask exemptions good for this year, or do we need to have those updated annually? That is your choice. The ones from last year were a requirement because the mask mandate was a requirement. This year, you're making your own rules. So if you want to consider those still good, you can. You know, typically, if you were to you know, you need a sports physical, if you were to need a waiver for a physical disability, other things like that, how would you address that? So if you had a patient, well, I'm sorry, you don't have patients, I have patients. But, you know, I recall writing notes for kids who had bladder problems and had to be able to use the bathroom whenever they needed to. You know, if you had a note like that, would you require it to be updated every year or not? And if not, then I would say, then you don't need to have a medical mask exemption updated every year because, you know, it's not changing. But if you want to make them have one updated each year, you certainly can. And if you want a new form, like a template, I do have one that I put together. It took out some of the verbiage that applied to the executive order because that's no longer in effect. Can you explain more on what a modified quarantine means or what it could look like? So a modified quarantine, we know that a lot of schools have already done this on their own. And so some other states are already doing this based on their own research. So a modified quarantine could be if you have students that were fully masked, again, both the sick and the exposed, you could allow the student who was a close contact to continue coming to school as long as they continue to be masked and have no symptoms, is one way some do it. Or you continue them to come to school fully masked and they have to have a negative rapid antigen test before going to class, whether it's at home or in the school. So those are different options. Some might not have masking and might say, well, they have to come to school wearing a mask, which really isn't sufficient. But if they got tested every day and wore a mask, you know, maybe that is an option. So that's what modified quarantine means. And again, once the state puts out their guidance, I already have some thoughts put together and will compile all that for you. With Ingham County issuing an order, I was wondering if there's a threshold being considered by MDHHS for our counties for an order. Oh, and so at this point, I don't believe we have a threshold. As far as I know from conversations with my health officers, I don't believe that there is a threshold in place. And then Steve put a link here with the recommendations for travelers, international travelers, so thank you. If students are masked and at least 3 feet apart, do not need to quarantine as long as they do not have symptoms. Yes, so that is right. And that's why, you know, modified quarantine wouldn't be necessary in a lot of situations if kids are masked. But yes, if they are masked, the only time they would need to quarantine is if they're less than 3 feet apart for more than 15 minutes in a 24-hour period. So you are correct. Do you anticipate statewide or countywide mask mandates coming? I have not heard anything about a statewide mandate, and honestly, I'm not holding my breath. And again, there are no current plans for the 3 health departments to issue mandates. And then there's a comment that the law firm Thrun has a good mask waiver medical form, so that's good to know. If a district is showing an increase in positive tests and went to a mandatory mask in schools, what metrics should they continue to relieve the mandatory masking? So in I think it was the ABC collaborative, one number that they mention is 10 per 100,000 per week, which is the green color for the CDC, that when you get to that level, you can stop masking. or if your school community or the community has 70% or more percent fully vaccinated. Those are pretty difficult metrics to meet, but those were the recommendations based on what others have found. So it is really difficult to give, and we've talked about this in the health department quite a bit. It's really hard to say this is where you can stop wearing a mask. Other things to look at would be, are you having outbreaks in your school? Are you seeing a lot of cases in the school and things like that? But the only number I've seen published is when you get to 10 per 100,000 per week and or 70% or more fully vaccinated. So using those metrics, it'll be a while. So I'm sorry if this has already been asked, but parents are asking if they can use home tests to show a child is negative for COVID when they have symptoms. Should this be acceptable? So that is up to your discretion, but I personally feel like if they're testing and you feel like they're being trustworthy, I would accept it. However, you would still need to follow that algorithm. So if they have symptoms and have an antigen test that is negative, they need to have a PCR test to confirm it. If they're a close contact, and no symptoms, the recommendations will be to use a rapid antigen for screening. So it's just a reminder that antigen tests, a negative test in a positive person has a high risk of being a false negative. But we have a lot of areas with lack of access to testing, and I'd rather they test than lie about it. And we know that, sometimes parents send kids to school sick anyway, so I'd rather they just at least do it. If you want to require that they take a picture of the results or something like that, that's kind of up to you. The next question was the validity of those tests. They are all FDA approved or authorized. A lot of them are actually the same ones that are used, like the Abbott ID Now test you can actually buy at the pharmacy. So they're the same ones that we use. They're not super complicated to use. So it's not a great analogy, but I use an analogy like a home pregnancy test, which those are really as effective as the ones we use in the clinic. And they don't let tests go over the counter unless they're confident that they have a low error. They're pretty user friendly. People can't really make a mistake. The main issue is if you feel like people are falsifying them, like, they're rubbing the swab on someone's forearm or something, or just not even doing it properly. But again, if you don't feel comfortable about it, you can certainly have, or not allow those or do testing at the school instead. But we're at a point where I think we just need to try to help keep kids in school as best as possible. And, if they can't get tested anywhere else, and that's what's keeping them from coming to school, I don't know. Should a positive rapid antigen test for an asymptomatic individual be trusted? So again, that's another part of that algorithm that with the rapid antigen tests, their main issue is they're not as sensitive. So if they give you the results opposite of what you expect, the best thing is to confirm it with a PCR test. So if someone is getting screened and they're totally asymptomatic, the best example is when we're doing our athletes and they had no exposures, no reason to be positive. If they're positive, then we did confirm it with PCR because we're like, could this be a false positive? Most of the time, because it is a very sensitive test, most of the time positives end up being positive. But again, we had sent out a packet probably 3-4 weeks ago called Managing COVID and Close Contacts or something like that. Page 9 has an algorithm that goes through how to manage antigen test results. And there's also an algorithm in the CDC that you can use that gives the same information, just not as many clarifying steps. So you have to kind of read the fine print a lot more on that one. So that was the last of the questions in the chat. If you have any more, please add them or unmute yourself and ask them. All right. Trust aside, the rapid antigen at home over-the-counter tests are to be considered accurate. Yeah, and I know we have a lot of debate. We have some people, we have an epidemiologist at the state who just thinks they're like, oh, people are gonna lie and fake them. And, it should be a good test. As long as people do them properly, it should be just as good as the ones that we do. So, all right, well, we will get the slides out and a link to the recording. And again, I would encourage you to check out that policy lab report, and I'll get more information on the modified quarantine options as soon as we get that. And if you think of anything else, make sure to contact us. Hang in there, everybody, and have a good long weekend.
Thank you. You too.
Yeah.